Hello students, myself Sony. Today we are going to deal with a subject gynecology and midwifery. So we'll move on to our chapter. The first chapter is the introduction chapter. This is not an important chapter, but we will go through the scope, trends, historical revolution, everything. So we'll move on to the first unit, that's a scope and the trends of midwifery. In that, the introduction, midwife is a person who is trained in assisting women during childbirth. She also provides prenatal care for the pregnant woman, birth education for the woman and their partner, and care for mothers and infants after childbirth. So midwife means she is a person, she is giving some care during the childbirth. She is providing care, prenatal care and the postnatal care, intranatal care. Also she is educating the partner. Also she is taking care of the child. So this is the midwife and the role. So this definition you can use for a midwife. Also there is midwifery. According to WHO, midwifery as a field that involves providing care to women during pregnancy, labor and postpartum period, and also providing care to newborn. It includes preventive measures for health problems during pregnancy, detection of abnormality, obtaining medical help, and taking emergency action in the absence of medical assistance. Midwife, she is the person, but midwifery is a field that involves a certain group of care. It includes prenatal, postnatal, antenatal care, but also it helps to identify the problems during pregnancy, detecting abnormalities, obtaining medical help, and taking emergency action in the absence of medical assistance. Okay, clear? So next is the history of midwife. The history is divided into two parts, before independence and after independence. In the first part, before independence, 1877, Miss Heschel started the first training school for the midwife. And 1899, Senina Bible and Medical Mission started the training for the nurses. And 1926, Madras Registration of Nurses and Midwife Act was passed to promote the role of registered midwife during childbirth. And 1936, midwife training was started as a separate course in India, and girls at the middle school level were selected for this training. Okay, I will tell you one more time. 1877, the first school of midwife was started. 1899, Bible and Medical Mission started the training for the nurses. In 1926, the registration for the midwife and the nurses act was passed to promote as a midwife during childbirth. Last 1936, midwife training was started as a separate course in India. First it was started as a school, and they given training. Then the Bible College and Mission, they were given the training. Then the act was passed by Madras registration. After that, there is a separate course started in India. Okay, this is a history before independence. And midwifery in independent time, 1946, the before committee recommended the need for qualified midwife, health visitors and train of midwife. So they need more qualified midwife and more health visitors. So that's why 1945 the committee recommended for the qualified midwife. And 1955 Shetty committee recommended training of actually nurses midwife in the health center for maternal and childbirth services. And 1959 Bishop supported the training of A&M and general nursing midwife. So from 1959 the A&M and Gnm course was started. 1947 the Indian Nursing Council combined the nursing and midwife course into a single course, 3.5 years, during with the entry qualification after 10th. So 1959 A&M and GNM was started, and 1947 they got the Indian Nursing Council given. There is a rule for nursing 3.5 years and the minimum qualification is 10th. And 1975 the Kartar Singh Committee recommended shortening of 2-year course, 1.5 for A&M, and the entry qualification was 10th. Okay, so for the A&M the course was 1.5 and the qualification 10th. For the GNM the duration is 3.5, qualification is 10th. So this is the history of midwife. Okay, all clear? Next we'll move on to the scope of midwife. The scope of midwife, the first scope, they provide sound family planning information and advice. That means they are giving family planning informations. Second, they diagnose and monitor normal pregnancy by carrying out necessary examination. Once a pregnant woman enter to the clinic, they will start with the pregnancy diagnosis. They will monitor there is any abnormalities. If there, we can dictate it. And the third, they prescribe or advise necessary examination for early diagnosis of pregnancy risk. By this clinic, we can easily identify a pregnant woman if she have any abnormalities or whether she is risk for pregnancy. The fourth one, they provide parenthood preparation programs and advice on childbirth hygiene and nutrition. Then move on to the fifth, they monitor the fetal condition in the uterus during appropriate clinical and technical means. Once a woman gets pregnant, they are also monitoring the fetus. They need to identify the fetus growing pattern is normal, any abnormalities, the heart rate, baby's movement is okay, everything they are monitoring. And next is they provide care and help to the mother during labor. That already we discussed. They conduct deliveries, episiotomies and breech deliveries, recognize the abnormality sign in the mother and the baby. They take emergency measures like manual removal of placenta and manual examination of the uterus. They provide care and monitor to the mother condition in the postnatal period and advise her on the infant care. Okay, after the delivery, they will take care of the mother, that's the postnatal. Also, they advise the mother to take care of the babies. They carry out the prescribed treatment. The last scope, they make the necessary written reports. So these are the scope under coming the midwifery. And next we'll move on to the role of midwife. Role of midwife is little bit important, so we'll go through this one. First one, they examine and monitor the pregnant woman. Okay. Second, they assess care requirement and write care plan. Third, they undertake antenatal care in hospital, home and GP practices. Because antenatal care is very much important, we can identify there is any abnormality, any prenatal care risk is there. So this is an important point. The third one, they undertake antenatal care in the hospital, home and GP practices. And the fourth one, they conduct screening tests. And next, they provide information, emotion, support and reassurance to women and their partners. Okay, not only for the pregnant woman, we need to give education, support for the partner also. So that is also an important role. And next one, they take patient sample, pulse, temperature and blood pressure. Next, they provide care and assistance to the woman in the labor for the delivery time. They administered medication, injections, intravenous infusion to the woman during labor. Next, they monitor the fetus during labor. They advise about the support parents in the daily care of the newborn. For the newborn, there is a daily care, baby care, cord care, how to sponge bath the baby, the vaccination. There is a lot of care we have to give to the baby. So they also educate the parents how to daily care the baby. They help the parents to cope with miscarriage, termination, stillbirth and neonatal death. So this is an important section because we need to give more, the nurse, the midwife need to take more anxious in the miscarriage, termination and stillbirth time, because they need an additional support in this time. And the other thing, they maintain return records, they train the students, midwife, and the last, they identify the high risk pregnancies. All of this is including the antenatal, intranatal, postnatal care. Like if the mother is antenatal period, we need to diagnose any abnormalities is there and whether she is any risk for pregnancy. During intranatal, we need to monitor complete labor time, and postnatal include the mother, include the baby, also the partner. So all these roles are important in the midwife. Next we are going to basic components of a midwife. Basic components, there are list of components are there. Essential components of midwife can improve the quality of midwifery education and services. So there are 8 dominants we have to be identified. Ethical and legal principles of midwifery, midwife practices, theological learning, learning in the clinical area, assessment and evaluation of the students and programs, organization, management and leadership, communication, leadership and advocacy. Last one, research. This is not that much important, and there are some general components also. That's the competencies. They take responsibility for their own decision and actions. They take responsibility for self-care, self-development. They delegate aspect of care and provide supervision. They use research to inform practices. They uphold fundamental and human rights of individual when providing midwifery care. Okay, this is not that much important, for just a general. Next is the trends of midwifery. Okay, the trends, will move on to trends. The first trends is technological advantages, increased cost of high technology care, changing patterns of childbirth, family-centered care, maternity care, increased cesarean birth rate, role of fathers, changes in the social structure and variations in the family style, expanded role for nurses, access to health care, shortening hospital stay, increased use of alternative treatment modalities, increased use of technology. So trends means trends are increasing day by day because the technologies are developing. So before for the normal delivery, maybe there are some risks are there, but technologies are developing and trends are increasing. So there are many changes in the social structures and variations in the family style also happens. So this is the trends in midwife. And next is the vital statistics related to the maternal health in India. Moving on to the vital statistics, the purpose of the statistics is to describe the level of community health, diagnosed community illness and solution for the health problem, mainly to diagnosis community illness and solution for health problem. Okay, and the second one, to determine the success of failure of specific health problem. Before we have some failure to detect the problems, but by the trends we got to determine the failures in the specific health problems. And third, to promote health legislation and local and the health national level. And the last one, to develop policies and procedures state at the central level. So there are some policies that developed in the state and central level. So these are the vital statistic, the purpose of the vital statistic. And the next one, the importance of the vital statistics. So purpose we studied. Next is the importance. Importance means to evaluate impact of the various national health programs. We need to evaluate, there are many national health programs are there. So we need to evaluate the various health programs. And the second one, to plan for better disease and control measures. Okay. Third, to explain hereditary nature of the disease. Next, to evaluate economic and social development to use as a primary tool for research activities. Okay, importance means we can plan a better disease control measure and explain hereditary nature of diseases, evaluate economic and social development, primary tool for research activity. Okay, and also this also coming in the vital statistics for the census, epidemiological surveillance, registration of vital events, sample registration system, health service record. Okay, and next we are moving on to use of vital informations. The uses are the vital information of a popular form that base for planning, administrating and effective management of health services and program. Okay, the main vital information in the uses is planning, administrating and effective management of the health service program. Second one, it aid in the assistance of health service for effective and efficiency by keeping updated records of all the events. Third one, it aid in the assessment of attitude and degree of satisfaction of the benefits from the health policies. And the last one, it aid in the measurements of health services status of population. So all of this, the important is they are giving information in a form like planning, administrating and effective management of health services and a program, and health service for effective and efficient by keeping updated records all of a event. And next is the attitude and degree of satisfaction of beneficiaries from the health policy, and the last one is measurement of health services status population. So all these are the purpose, important and the uses of vital information. So these all are the first unit. We'll just conclude. First we studied the definition for midwife and midwifery. Midwife, she is a person who is giving care for antenatal woman, intranatal, prenatal, postnatal, also the baby care. But midwifery, she is a person also, it include a field of involvement. It means she is taking care of the pregnant woman during intranatal, postnatal, antenatal, also detecting abnormalities, obtaining medical helps and conducting delivery in the absence of medical assistant. Next we studied history in two parts, before independence and the after of independence. Next, scope also we studied. There are many scopes are there. Some important scope, they provide sums of family planning information, necessary examination, preparation of programs and advice on childbirth. So these are the scope of midwifery. And next is the role same as antenatal, intranatal and postnatal period and the neonatal care. Next is basic components and general components also we discussed. And trends means by the development of technology, trends also are increasing, that is giving good delivery pattern. And the last one, vital statistics. So this is the first unit. If you have any doubt in the first unit, you can message us. So students, this is the conclusion for the first unit. We studied trends, historical revolution, vital statistics, roles, everything. If you have any doubt, you can comment in the comment box, and every time we will help you. Download Nursing Guru and follow us for more update videos.